Imagine you are the doctor. How do you know that the tablet you have just prescribed is actually helping the patient? Well, it can be fairly simple when the tablet is used for symptoms which can be measured objectively. For example, you can measure the amount of urine produced after prescribing them a tablet to pee. Or you can measure their blood sugar level after prescribing a tablet for their diabetes. However, it's more complicated when the tablet's used for symptoms which are more subjective to interpretation. For example, using vitamin C to improve the sense of global well-being, or using vitamin V to improve the sense of regional well-being. How do you know the patient's not feeling better simply because they believe the tablet's going to help them? In fact, some patients will feel an improvement even if prescribed a sugar pill which contains no medication at all. This is called the placebo effect. So how do scientists account for the placebo effect when they put a new medication on test? How can they be sure that's indeed the medication that made a difference? Well, one way is by combining the medication and the placebo in the same trial and then compare the difference in outcome. But more importantly, the patients are told they'll be given a tablet which may or may not contain the medication, but there's no way for them to find out. This is called blinding. Now, it's been shown that by blinding the patients in a clinical trial, the placebo effect can be balanced out. Great solution, but you see another problem. Now, this time, imagine I'm the doctor handing out tablets to patients being tested on the tablet, the medication. And I happen to know that the tablet in my hand is the real deal. It's quite possible that my body language may give away certain hints to the patient. Watch this. Take this pill. It might make you popular with your lady. I may have introduced a bias in the study and compromised the whole effectiveness of the trial. So how do we overcome this problem then? You guessed it. We blind the doctors too. So in the clinical trial, even the doctors aren't told whether the tablets contain the real medication or not. This is called double blinding. So neither the patient nor the doctor knows what's happening, just like what happens in the hospital. Now you must be asking, how is it possible or ethical to blind doctors in a clinical trial? Now, this can be done by randomly allocating the tablets used each time. Hence the rationale behind randomized clinical trials. So please put up your hand if you'd like to hear more about randomization in clinical trials. There, my dear judges, are the reasons why you should let me through to the national